Good afternoon, ladies and gentlemen. Thank you so much for having us on your radio and television sets. It's a pleasure being with you. Cameroon is currently experiencing a surge in monkeypox cases since the year 2025, and as of February 16, 2026, the country has registered 116 suspected cases, including 22 confirmed ones. The Lithra region remains the epicenter of this outbreak. Recently, a vaccination campaign was launched at the Lakentini Hospital. What is monkeypox all about? We'll be having answers from a health specialist who is currently a public health specialist who is currently with us in the studio. Good day, Dr. Ahmed. It's a pleasure to have you on the program today.
Good day, Immaculate. Good day, viewers of Equinoxe TV. It's nice being in the studio once more this morning to talk about a very pertinent issue that is disturbing the public health sector.
Exactly. We'll be looking at monkeypox. We already have 116 cases, suspected cases, and 22 confirmed cases. Lithra region has been considered as a epicenter of this outbreak. First of all, before diving into the details about what monkeypox is, can you tell us more about this disease and how it differs from chickenpox?
Yes, Immaculate. Mpox, popularly known as the monkeypox, is a viral infection which is caused by a virus known as the orthopox virus. And this virus replicates very rapidly. It is very similar to smallpox that we have had in the late 70s and early 80s. And it's rapidly spread in humid environment in Central Africa, East Africa, and the West Africa are the predominant areas where it is spread because of the humid tropical and subtropical climates.
And how can we distinguish this monkeypox from other cases like you talked about smallpox, chickenpox, and others?
Immaculate, all of them are viral infections, and to distinguish them, most often we will realize that Mpox is a kind of fever, or it is a kind of infection that sometimes disappears on its own, and is an endemic disease. It's not pandemic like the other ones we are talking, or epidemic like the other ones we are talking, where they come up and disappear. But the Mpox or monkeypox is endemic, which means it's always in the community, and can now maybe create some multiplication, or the crisis can go higher in other areas. I would say it's an epidemic condition. Meanwhile, the other ones are mostly epidemic disease. They come and go. But the Mpox is always with us.
Given that it's always with us, is there a reason for us to be concerned about this disease?
Exactly. We need to be concerned about this disease, though actually it's not really a danger to the community, but it's good to consider because it has other damages that it can cause to the body, and its symptoms too can come with a lot of health complications.
For those who would like to participate on today's edition of the program, here are the contacts: 670-5470-49. I repeat, 670-5470-49 or 656-622222. 656-622222. Back to you, Doctor. How is this disease transmitted?
Yeah, the disease is mainly transmitted through contact. Contact is a primordial way of transmitting Mpox or monkeypox is through contact. That is skin-to-skin contact can be transmitted. Then through saliva, possibly through saliva, droplets of saliva from an infected individual, it can also be transmitted. Then you have blood transfusion. It can be transmitted in blood of infected animals. Secondly, it is also can be transmitted through sexual contact. You know what we say sexual contact, though Mpox is not classified as an STI, as a sexually transmitted infection, but since it's transmitted through contact, since intimate kissing, something like it's intimate kissing, it can be transmitted, and then during sexual intercourse too, it can be transmitted. So we also have things like saliva. It can be transmitted through saliva or mucus.
And how can I tell someone is suffering with monkeypox?
To actually conclude that it is monkeypox attack, there are a group of vital symptoms that we have to take into consideration to be sure that it is monkeypox. The first one is rashes. We have rashes all over the skin, painful rashes. We have fever, frequent fever. Then we have swelling of the lymph nodes. And then we have chill and tremors, a kind of fever that comes with tremors. And then you have headaches. You have muscle ache. Sometimes some people have pains in their muscles. We have general fatigue, and then we have back pain, and then we have joint pains. We know these collective signs and symptoms can stand for another health complication, But we collect this sign and symptom, about 5 to 7 to 8 of these vital signs and symptoms of monkeypox. You need to go for a test to be sure, because other complications that also is within the community can cause these complications or these symptoms.
Can a child suffer from monkeypox?
Yes, children are very exposed to monkeypox, and pregnant women, because of the weak, the children, first of all, because of their weak immune system, their immune system is still very weak. And secondly, too, it can be easy in children. You know, most children are born with some rashes because of their skin. The epithelial tissues of skin are not yet so resistant to infection like in adults. So it's very possible, very predominant in children, and sometimes too in pregnant women.
You talked about animals being another way of transmitting this disease. Are there some specific animals that have this monkeypox virus that we need to be worried about?
Mostly, the most animals that are very transmitter agents in the Mpox virus are rodents. Rodents like rats, like pigs, like rabbits, like cats. Those small rodents, some of them can be in our houses. Most of these rodents are animals that are domestic. Maybe we rear them or they invade our homes. They can be a transmitter organ for this. And then some of these rodents are eaten by man, so it can easily spread the contamination to human.
Now, according to a report made public by the Ministry of Health, Public Health, I think we'll have a call on the line before we come back to that question. Hello, good afternoon.
Afternoon.
Yes, sir. Yes. Your name, where you're calling from, and your question, sir.
I'm in Douala.
Okay. Your name?
Swanky Albi. So I don't know, how can I get to you people for the consultation or text?
Consultation on?
For what you people are just talking on TV.
Okay, you have to call us at the end of the program, so we'll give you more details on that.
Okay.
Thank you. Thank you so much. Okay, as you saw him asking his questions, for those who have other questions to ask about the monkeypox virus, the numbers are on your screens. And for those who are on radio, the numbers are 670-54-749, 670-54-749, or 656-622222, 656-622222. Back to you, Doctor. According to a report made public by the Ministry of Public Health, the Lithra region is the epicenter of the outbreak. Are there any specific factors making this region more vulnerable than other regions?
Yeah, Immaculate, I think when we talk about Lithra region, you realize that the town in Lithra, which is very cosmopolitan, is Douala. And then since we said the monkeypox can be spread through contact, if you, for example, if you come to Douala, Douala is so cosmopolitan, the markets are very cosmopolitan, you have skin-to-skin contact are very obvious. Even some homes, you get one room, you have so many people in the room, living in a single room. So if one person is infected, it is possible. Douala is a kind of an entry point of population of royal exodus. And so it becomes very challenging to handle things like this because it can easily be spread. Another point is that the climatic condition of littoral is very humid. It's a coastal climate and favor the multiplication of this virus. Another point is poor hygienic conditions. Now, when you look at this, when we're talking about littoral, we can focus a bit in Douala. Poor hygienic condition can lead to the spread of this particular monkeypox virus. So if you look at the sanitation in Douala, is not actually 100% perfect, even not up to 70% perfect. And so we look at some areas, especially residential areas in some quarters in Douala, it is very, very obvious that any epidemic or any pandemic or any kind of outbreak can easily be spread in this environment. Another one is promiscuity. You see, we said the monkeypox can be spread through sensual contact. So you see, in Douala, where there's a lot of promiscuity, also there's possibility, because any prostitute living from northeast, southwest, who think of making financial or making some financial gain through prostitution would simply dive to Douala. So the rate of promiscuity in Douala is very high. And we still want to emphasize to our audience that this is not an STI. It's not a sexually transmitted infection. It's transmitted through contact. But the more people have sexual contact, the more the chances of spreading it more. That is one of the problems that we have to hear. And then another one thing that is also favoring Douala is the sometime during rainy season in Douala, you realize that we have a lot of flood, we have a lot of deaths accumulate here and there, and this can lead to outbreak. It's just that Douala has been very lucky that over the years they have not actually been having epidemics like cholera. Yeah. I think it could have been a very favorable environment, because anywhere where you have flood and you have poor sanitation and hygiene, there is bound to be an outbreak. So we are facing this in Douala. But when you go to rural environment, most of the people in rural environment now in Littoral or in Cameroon as a whole, they can contact this particular virus mostly from consuming some of the animals we've mentioned before. Because most villagers, they rely on these animals for food.
Exactly. And when, in case you are now, you have confirmed that you are suffering with monkeypox, what's the next step to take?
There are some simple home remedies that people who are battling with monkeypox infection can do at home. The first thing is isolation. If you realize there's somebody at home who is already battling with monkeypox, you can isolate the individual. Not isolating.
We have a call on the line. We'll come back to you. Hello.
Good afternoon, Madam.
Good afternoon, sir. Thank you so much for participating in the program.
I just want to ask the doctor that I'm facing a gastritis and knee pain. What can I use for that purpose? Thank you.
He's talking about
gastritis. That he's suffering with gastritis and knee pain. What can he do about that? Even though we are not talking about gastritis, but just for the sake of our
audience.
Exactly.
Okay, thank you for calling, bro. I think we will still planning to treat something very intensively on gastritis because it's a public health challenge. But for now, I will just guide you to go for OTC, over-the-counter medication. You can get things like, after consulting a physiotherapist, a physician, you can go to any pharmacy, you get something like opramistrazole, you can get something like cimetidine to take. But the guide I want to tell you is that when you're battling with gastric, you need to be taking a lot of water, you avoid eating late in the night, you avoid too much oily food. Because no matter the medications you take, how effective it is, if you are a late night eater, you consume your meals, the gastric will not go. If you consume a lot of oil, gastric will not go. If your system is dehydrated, gastritis will not equally go. And then you reduce a lot of sour fruit. We collectively call them citrus fruit, especially on an empty stomach.
And also, he has to go to the hospital to get
You have to go to, that's exactly,
I said,
he has to go to a physician to diagnose, to confirm that it's gastritis, because some of the time, some signs and symptoms which we think is gastritis, inflammation of the gastric walls, may not be actually the gastritis itself.
Exactly. Now back to the questions we're talking about. When you have been diagnosed with monkeypox, what's the next step to take?
So the first thing is we will advise people the home remedies for those who are at home to actually do some good hygiene. They take then they do a lot of, make sure their bathings are washed and then maybe with detergent, and then to sterilize to prevent further spread. The next thing is
we have another call on the line. We're coming back to that question. Hello.
Yeah, hello, madam.
Yes, sir. Good afternoon.
Hello, madam. Good afternoon.
Good afternoon. So your name, where you're calling from, and your question, please.
Yes, I'm calling from Koto.
Okay. Go ahead.
I'm calling from Koto.
Go ahead, sir.
Yeah. Excuse me, I want to know something about the monkeypox. If somebody have been in contact with someone who have taken monkeypox,
yes,
how can we do for all people who are in the house?
That's exactly what we're
That's what we're trying to answer. Okay, we are going to be answering that now. Thank you so much.
I think, madam, this is exactly what we're trying to answer. We're saying that the person who is already dictated with the monkeypox virus should be isolated. Isolated means should not be in very constant close contact with other uninfected individuals. The second thing is why we said we have to disinfect his dresses by washing them with detergent like Dettol, to make sure that the virus is eliminated. Another thing is, another good thing is we can go for over-the-counter medication for the individual concern. If you go to any pharmacist, or any physician that go to prescribe you medication. That's OTC, over-the-counter medication that can help. And then people can wear masks in that house where there's somebody suspected. As I said before, that it is possible to be spread through sputum, saliva. So people in their house where one or two people are already infected can be on the mask. They can put a face mask. This would be good to prevent it. But in the case, we are coming to talk about prevention. I think we should just use it to talk about prevention.
Exactly, yeah.
Should in case we are already in a situation where chances, like already are talking about some cases already in Douala, we need to go for vaccination. Vaccination will solve this particular problem. When you vaccinate, the chances of contacting it becomes almost zero.
Now, talking about the case of babies, imagine a child suffering from monkeypox. How do you expect the mother to isolate that child?
Yeah, I think this is the first thing is it's a good hygiene. The baby, there's possibility of the baby being wrapped in uncontaminated dresses, maybe the towels, the changing, the napkins, anything that's removed out of the body of the baby should be soaked in detergent and washed. And frequently they have to be changing the napkins or the bed or the dressing of the baby to cope with this, because there's no way you can isolate a young growing baby, especially those in the hand or the teenagers or those who are still toothless baby, maybe below 3, 4, 5 years. You cannot isolate them. So it's good to give them good hygiene and make sure they don't stay long with the dresses throughout the day.
And how long does it take to treat someone suffering with monkeypox?
21, let me say, just estimate that 2 to 3 weeks is maximum. Maximum 4 weeks, that's a month. With good medication, monkeypox can go. I would like our audience to also know that all of us once in a while must have had monkeypox. It appears in us, but since we never knew the name, we never knew the signs and symptoms of monkeypox, it goes on and on, because as I said from the beginning of the program, it's an endemic disease, which means it's always with us, like typhoid and malaria. It's always with us. It's just that in certain cases it manifests. So our immune system keep battling it. So it comes up, but you don't notice because the immune system has succeeded in eliminating the virus.
Okay. Now, are there any misconceptions about monkeypox you'd like to tell us about?
The first thing is that the first...
We'll come back. We have a caller.
Okay.
Hello?
Yeah, hello?
Yes, sir. Good afternoon.
Yeah, good afternoon, madam.
Your name, where you're calling from, and your question, please.
My name is Abdul Karim.
Okay.
I'm calling from Yaoundé.
Okay, sir. Go ahead.
I wish to know about skin itches. Is it part of the program?
Skin itches.
Yes.
Yes, definitely. It's part
Yeah,
of the
definitely.
program. One of the signs and symptoms of monkeypox.
We mentioned the vital symptoms of signs and symptoms, and then itching was one of them. But we don't want to conclude that it's every itching that is a monkeypox virus,
exactly.
because there are many other skin infections that can bring itching. For example, the most common fungal infection called eczema. So you see, it brings itches in the body. There are many things. Even diabetes can bring skin itches. Kidney problem can bring skin itches. So when you have skin itches, you have to go immediately for a diagnosis and in a good hospital, so that they diagnose what the root factor or the backbone cause of the itching you have in your skin. We cannot conclude that is monkeypox.
Exactly. Why we are insisting on the fact that people have to go for diagnosis in order to be sure of what they are suffering from.
Exactly.
And now we're talking about some misconceptions about monkeypox. What are they?
Yeah, I think there are some few misconceptions that people think about monkeypox. The first thing is that people think it spread like COVID-19. No. It's not. It doesn't spread like COVID-19. COVID-19 was an airborne infection which can go more rapidly than Mpox. Spreading Mpox will be being in close contact for a very longer time with the infected individual. Meanwhile, COVID-19 could spread within a twinkle of a second. Another misconception people have, people think that it comes from sexual intercourse. No. It is sexual intercourse promoted, but it's not an STI. Why do sexual intercourse or promiscuity promote it? Because it is a contact, it's spread through contact. So there is no copulation without contact. There's always contact before copulation. So it's spread it. It's not an STI. And some people think that no, it's only the monkeys because they call it monkeypox. No. The first cases of monkeypox was traced as far back as 1958 by World Health Organization in monkeys, actually. But in the early 70s, the first human beings were dictated with monkeypox. They were transmitted to monkeypox. As we already said, that there are animals that are transmitter agent of this particular virus, and some of us consume it. In the long run, it spread to the people. So the dogma that monkeypox is only for it attacks only monkey is not right. It attacks human beings. It's very common. Another misconception about monkeypox is that it is found only in particular areas, that the outbreaks or the epidemics can only be in particular area about monkeypox. No, it can happen anywhere. As I said it's a tropical and subtropical complication, public health complication. So it can happen anywhere. Anybody who was there in late 80s or early 80s, late 70s to early 80s, have seen the way the World Health Organization battled to eliminate the smallpox, which was a bigger brother to the Mpox. Because smallpox, the isolation was completely out of the village. So you see, it was more deadly than chickenpox. So it is a normal infection.
Thank you so much, Dr. Ahmed, for a public health specialist. It's a pleasure having you on the program today.
Thank you very much, Immaculate. Thank you. Our audience will keep watching Equinoxe TV for this particular wonderful program for your health education.
Thank you, ladies and gentlemen, for your keen attention. We received technical assistance from Jonathan Babula and equally from Bertrand Bonzini. From us to you over here, to you over there, thank you for staying with us, and have a wonderful day. Bye-bye for now.